where they will help you to elevate your health, activate the GHKCU peptide, and regenerate your own stem cells to help the body literally become a healing machine. Danielle, are you on, baby?
I'm here. I'm here.
Oh, girl. Okay, you have got to share with everybody what has gone on. Let me pin you here, right? Let me stop the share and pin you so they can all see your beautiful face. Oh, so happy you're here. Hello,
hey guys.
She's so athletic too. I love that about Danielle. She's just such an athletic gal. So share what's happened. Share a little bit about who you are, where you're at, what you do for a living, and then what happened today. So exciting.
All right. Hey guys, Renita and Scott, thanks for having me on tonight to share a little bit of my excitement. So my name's Danielle. I'm a nurse practitioner here in Alabama. I've been in healthcare for over 25 years. I've been, in fitness, wellness, all the things. Had a little health scare about 10 years ago. I was working night shift. You know how that goes. Getting my 4th degree, doing all the things, not taking care of myself, eating crap, not working out as much, and had the thyroid storm hit and was diagnosed with Hashimoto's hypothyroidism. And that kind of started my health issues. So anyway, I was put on medicine, high doses of levothyroxine, and then it tumbled into other things. I suffered with insomnia, IBS with constipation, developed something called chronic idiopathic urticaria, which are chronic hives that cause anaphylaxis and severe asthma. I mean, I was doing EpiPens a couple of times a year to prevent, death. I mean, it was that serious. Got started on a biologic injection called Xolair, 1 in each arm every 4 weeks for 9 years. Was in chronic pain, hips, joint, back, neck, shoulders, knee. I was a competitive gymnast, cheerleader my whole life, and it was just catching up to me. So I was on about 7 or 8 medications. Hated every bit of it. Got stupid COVID, had to get vaccines required for my employment or termination. So then developed hypertension and tachycardia from that. And was on a statin for hyperlipidemia, which they said it was familial genetic kind of thing because I always ate healthy, worked out, that sort of thing. But anyway, started patching a little bit over 6 months ago and went for my 6-month wellness visit today. I started patching. I was a one patch wonder. I started feeling like, okay, I have a little energy. More mental focus. I slept better, and I'm like, no, that's psychosomatic. It's in my head. It's not real. Day 2, day 3, same thing. And I'm like, okay, there's something to this. So I started tapering off my medications because my blood pressure normalized, my heart rate normalized. So tapered off of that, stopped that. Same thing for all my other medications, even tapered off the thyroid medications, stopped the biologic injections, and had my blood work. Of course, I did not inform my physician, so I don't recommend this, but I am a healthcare professional and I know a little bit more. So anyway, I was feeling great. Went to get labs last week, went to the doctor today. Blood pressure has been perfect. My resting heart rate's been in the 60s. Labs came back, CBC normal, kidneys normal, liver normal, my lipids, my cholesterol came down. My good cholesterol, HDL, was in the upper 70s, which they could not believe. My thyroid, TSH, was lower than it has been in 10 years off of medication. So, wow. I mean, I would not
You're
have
a healing machine, girl.
I would not have believed it if it did not happen to me. I would have said it's bogus, it's snake oil. There's no way. But y'all, it's legit. It is legit. And I am a walking miracle. And I'm so blessed and grateful and thankful that someone inboxed me and said, you need to look into this, because I was starting a telehealth business and I have not looked back ever since. So there you go.
Wow, wow. And I should say before we said all that wonderful information that the patch doesn't treat, cure, prevent disease, right? We have to
Correct.
say that, but individual results may vary. And like you said, Danielle, you're a healthcare practitioner, so you've got the working knowledge as you're eliminating some of these medications. So now let me get this straight. You're off of all of your meds?
Every single one of them.
Wow.
Inhalers. I don't need EpiPen. I don't need steroids. I don't need antihistamines. I was on Benadryl and Zyrtec almost every day of my life. I was on a statin drug. I was on medicine for sleep. 7 or 8 medications plus the biologic injection, and I'm off every single one of them. And my blood work is better than it was 10 years ago.
Oh my gosh, you guys, who's excited about this story? I love this testimony tonight. Okay, so since I got you on here and you're a nurse practitioner, you're into healthcare, right? Like you said, you started a telehealth business. Tell me how you've been implementing this with some of your patients. Like, how is that working? How does that look? And because I'm assuming that knowing what you know now, like you have a bent to natural health and healing versus the prescription drugs and the injections, which we know are just all consuming and very much pushed in the medical industry, right? And sometimes necessary. Yes. But now we realize that our bodies are healing machines, and there's natural things like this patch, this phototherapy patch that we can do. So how are you sharing it with your patients, Danielle? Would you care to share that?
So first off, American healthcare is a sick care model. We are taught in school how to treat a disease more so than how to prevent things and what to do besides medication or ordering more tests or things that cost money. And the last few years, I've had a wake up call saying, all my patients are getting sicker and sicker. They're on more prescriptions. They come to me because I did gastroenterology, hepatology the last 8 years with GI side effects from all these other medicines. So I'm either having to figure out which one to stop or add a new medicine and all that. So it's the system. It's what we're taught. You get rewarded for more appointments, more visits, ordering more tests. So anyway, what I'm doing is, it's about a person's personal history, what their symptoms are, what their goals are. And I just tell them, medicine's not the answer. You have to look at your nutrition. Your nutrition is important. You have to look at getting sunlight. The sun does not cause cancer. It's chemicals and toxins that cause cancer. Get out in the sun, take your shoes off, walk on the grass, walk around, exercise. It does not have to be, CrossFit. It can be, yoga, whatever. Move your body, dance, something, get active. And then I talk about this patch because a lot of people are catching on that healthcare is not for them. Like their doctor does not have 30 minutes to sit and talk with them and answer their questions. Wow. And I got to the point where I wasn't either. I was shooing them in 10 minutes, in and out. And that's with documentation. So now I spend time and listen, and the X39 does it all. So whatever your body needs, it targets that and heals that from within. I mean, it's literally, David Schmidt is a freaking genius. So anybody in healthcare, you're going to take a deep dive like I did into his research and his background. It's insane. It is insane. I've never met anyone like him. And I've been around a lot of doctors and surgeons and, brain surgeons, and there's nothing like this man. But I just tell people this is something that will help you get to whatever your goal is, be it sleeping better, be it weight loss, anxiety, anything. It literally is a do all in one. And it's simple. It is a quarter-size Band-Aid that you put on your body for 12 hours a day. It's so simple.
Wow. Danielle, you are a complete blessing tonight. Just the last part you shared is just icing on the cake. I knew that you had this wonderful testimony yourself. And when I saw you with the excitement of sharing it, I'm like, you will bless somebody by sharing what's happened to you. And then the fact that you're in healthcare, you saw patients, you see patients still, and you're recommending this patch because, like you said, it goes in the body and it goes to work, whatever that body needs. And again, we're not saying it's going to treat, cure, prevent any disease. God is the ultimate healer. I always say we're not the FDA, so I don't ask me medical questions. I'm not a medical expert. I am a health expert, right? And so your heart, your lungs, your brain, everything. It sounds like everything on your body has just literally improved, Danielle. So we are so thankful that you share with us tonight. And